Hey, so I just wanted to give a little update about how I've been doing and what's been going on. So, there really hasn't been a whole lot going on, which is why I haven't really made a video in a couple of weeks. Um, it is now less than a month until I have surgery. Um, it is going to be he had said it was going to be the decompression, just the bone removal of the lower part. But I did have another MRI done just to check on everything because I was having an increase in a lot of pressure in the back of my head. So they just wanted to check the veins out. So I had what's called an MRV a week or so ago. And I I had it locally and then had the imaging sent to that specialist office. And I know that they usually pick up on things that regular places miss or don't realize. So I know that the radiologist's report from where I live that read it didn't really see anything on there, but I don't know exactly if they have received that yet or how that's all went. It's kind of confusing when you have a specialist that orders it and you have it done by a place that isn't, in network with them. So I don't really know how that works and how fast they're able to receive it and anything like that. But I do know that I received my pre-op paperwork, and the pre-op paperwork states what the surgeon's plan is for my surgery. And that pre-op paperwork said that the plan is the decompression and the posterior fossa decompression with C1 laminectomy and autologous duroplasty. So I'm not sure if something was maybe input wrong on those paperworks that I'm going to be having, fill out by my primary care provider and all the testings and stuff I need to have. I don't know if maybe something was input wrong when they were doing that and I am not actually having that done, or if the surgeon got the new MRI results and then decided that I should just go ahead with the Durapatch and laminectomy also, instead of just the bony decompression. So that's kind of where a big question mark is for me right now. I'm waiting on a call back from his nurse to, let me know if that was a mistake or if what he thinks is the best course has changed. So I'll know that and I'll share that in my next update when I have an answer to that. I had gotten a cold, and I think that's why I was having so much pressure in the back of my head. I just could not get comfortable at all. And like I always have a constant pain or a constant ache in the back of my head. And body aches and pains, but this was just a lot more intense, and there really wasn't any way for me to kind of move and maneuver to get relief, even for like 5 minutes. So it was really miserable. And I noticed that as I started getting better, feeling better, and being able to move more and stuff, the severity of that pain has decreased. So yeah, I still live with pain. I'm in pain right now. I just, it's like I have to live with it, and I can bear it, kind of thing. Also, I want to just have a quick, thing to say about support groups. So I know that a lot of times support groups are very helpful, and being able to ask questions and see how other people cope, what they do, what doesn't work for them, and then kind of like gleaning all that information to figure out a way for it to help you in your life. But I think that when you have certain conditions, sometimes support groups can cause the opposite effect. It could make us more anxious, more fearful. And I feel like that's really the line that we want to be careful of when we are joining support groups is, yeah, you know, sometimes we may need support and we have fears, and people may share their fears on there. And we need to just keep in mind that just because of what somebody is fearful doesn't mean that that's going to happen for us. And if we find ourselves in the situation where we are looking through comments and reading things in support groups and it's not having a soothing feeling on our mental health, it's causing more of an anxious and fearful response from reading what some people say, it's better to just maybe mute that support group for a little while and be very careful about what we are reading and taking in, because we need to try to stay positive. We need to focus on all the things that we can control, doing everything that we can do, figuring out ways where we can help ourselves the best we can, and knowing that there are people who have different things and they learn how to live with it for a long time, and there's no reason why that can't be us as well. And I don't think that anybody is, you know, bad or wrong for sharing their fears. That's what the support groups are there for. And I'm sure there are people who are in a good place that are strong enough to be able to lend them the help and support they need. But for other people, if they aren't in that spot yet and that's just causing anxiety and more fear to read those comments, we don't want to feed off of that fear. If we aren't at a point where we can help calm someone else's fear and stay calm within our own selves, then we should just avoid coming across different information or comments that is not ultimately going to help us. So I don't know if that makes any sense, but I know that I recently needed to take that advice, and that's kind of what I have tried to teach myself in order to cope with some of the things that I have seen and some of the fears that I have, and the way that I want to live my life with needing to deal with these conditions for the rest of my life. I want to be able to function, not be too scared to do the things I need to do to try to get better, and to live the best possible life with joy and love and laughter and enjoying the time that I have with my family. So that's my little bit of 2 cents. I don't have a lot of information. I think my next video will probably be, maybe I'll share with you guys what all I have been accumulating in preparation for surgery and right after surgery, to try to be a little bit more comfortable. What my plan is as far as that. So I can show, you know, the things I plan to pack and bring with me. And because we'll be staying in a hotel for a couple of days after I'm released from the hospital before we try to travel back home. And I can go over all that planning process and everything too for anyone else who needs to do a similar thing for their health. So that's all I really have to talk about today, and I will see you guys next time. Okay.